So a little bit of context. February of 2009, Congress passed the high-tech legislation, which was part of the American Recovery and Reinvestment Act that we all know as the stimulus package. Wise people decided, let's use stimulus money to invest in healthcare. And so what we're all working toward in large part is funded through some of these stimulus dollars. A significant part of the legislation was a set of provisions designed to promote the use of health information technology and data exchange. The most important new term to be added to our vocabulary in a long while is the term meaningful use. We had no idea what it meant in 2009. In fact, we had to wait several more months. Two important initiatives were created to promote EHR technology adoption and meaningful use, and those were the CMS EHR Incentive Program to provide a financial incentive to defray the costs of providers acquiring, implementing, and then using EHR technology, and a related program, the Regional Extension Center Program. The Regional Extension Centers were directed to support physicians and practices adopting, implementing, and using electronic health records. 1 year ago, during the REC kickoff, I said getting a significant number of clinicians to use technology effectively and qualify for incentive payments will be a challenge, but we believe it's a challenge that collaboration can successfully overcome. In July of 2010, last summer, final regulations were published for meaningful use by CMS and Department of Health and Human Services. At the same time, requirements for EHRs to be certified were established. So here we are now, really 2 years past the original passage of the legislation and almost a year since the regs were passed. The good news is, in all of this, that if you are a physician or a medical practice, there are incentive payments for you to make this leap. In fact, we're going to celebrate some of those early adopters this afternoon who have received early payment on the CMS incentives. By our estimate, in this region, if everyone were to achieve meaningful use and do so at the highest level, which essentially means at the earliest point in time possible, there's at least $75 million in federal incentives available to physicians in our tri-state area. If we add the hospital component to this, it's over $200 million in federal incentive payments that will come into our communities. That is where the Regional Extension Center comes in. In February of 2010, the U.S. Department of Health and Human Services awarded 60 Regional Extension Center programs. One of those programs was here in the Cincinnati area to HealthBridge and its partners, which Bob introduced a little bit earlier. Our grant is for $10 million, and we actually don't have access to those $10 million until a physician actually enrolls with the Regional Extension Center as a participating physician. So it's really the physicians who decide whether that $10 million of Regional Extension Center support will in fact come into our community to be used. Our goal is to help more than 1,700 priority primary care providers reach meaningful use and use electronic health records. Nationally, the Regional Extension Center program is designed to support 100,000 primary care physicians and related caregivers to reach meaningful use. Today, in the tri-state area, we've signed over, or nearly 1,100 primary care providers to Regional Extension Center participation. That accounts for 155 separate organizations. On average, each organization that we have signed enrolled in the Regional Extension Center has, I guess, median size is 3 providers. So I think we're doing an excellent job in terms of reaching out and supporting small practices, and indeed we have many even sole providers who are among that mix. We plan to complete enrollment, which is to reach 1,740 physicians enrolled in the Tri-State Regional Extension Center by July of this year, and then begin, or continue actually, the process of moving them through EHR adoption and then eventually to their meaningful use payments. A little bit about today's agenda. We have some fabulous speakers, plenary speakers, as well as breakouts. Our team and staff and partners have put together this conference with your needs really in mind. We've tried to have a mix of plenary and breakouts that provide an educational benefit, and then also longer breaks between the sessions so that you can learn from each other and take advantage of your peers who are here today as well. We've tried to bring together national experts along with state and local innovators and leaders who have not only have big ideas but practical ways of pursuing what we all desire, which is a more connected, more IT-supported healthcare system.